small group discussion of B10 from the Bachelor of Medicine and Medical Doctor Study Program, Faculty of Medicine of Udayana University 2023. Today we will present our student project entitled Prescribing for Diabetes Mellitus and Hypertension for Elderly.
Hello everyone, my name is Janarka Pramesti with the last 3 digits of the number 208. So now I'm going to tell about the patient problem from the case above. The case above, the patient has a main complaint of back headache, and this complaints direct patient to symptoms of several diseases such as visual problem, seizures, and also dizziness. After doing an anamnesis, it was found that the patient didn't experience fever, vomiting, shortness of breath, and had a habit of drinking coffee 3 times a day. On the result of examining the patient's blood pressure, was found that his systolic blood pressure was 160 mm of mercury, and his diastolic blood pressure was 100 millimeter of mercury. So that is signifying the patient had hypertension. Hypertension is prone to occur in elderly people aged 65 years old and over. In the case above, the patient is 65 years old, so he's prone to hypertension. That's all from me, and my partner will continue. Thank you.
Hello everyone, my name is Lohelisa Cynthia Dewi with the last digits to the number of 223. As what Rizka has already explained, now I will tell you more about the treatment of hypertension. Treatment of hypertension can be done pharmacologically and non-pharmacologically. Pharmacological treatment is usually carried out by using drugs in the form of ACE inhibitors, ARBs, diuretics, calcium channel blockers or CCB, and beta blockers. In the case above, the patient is already in the elderly category, so it is very important for us to choose the drug properly to avoid polypharmacy. The principle of treating hypertension in elderly patients is carried out by administering low doses of drugs and increasing them gradually. In elderly patients, the drug that is usually given to treat hypertension is CCB or calcium channel blockers. However, the use of this drug still needs to be followed by lifestyle modifications such as not smoking, doing physical activities, and losing weight if you're obese. Thank you.
Hello everyone, my name is Nimade Aprilia Dwisisyanti with 3 last digits of student number 229. In this case, I will explain about the therapeutic objective. The patient is an elder man who suffers hypertension, in which hypertension has a close relationship with elders due to a decrease in elders' body immune response. There's 2 ways to reduce the hypertension. The first one is non-pharmacological ways. The second one is the pharmacological ways. For non-pharmacological treatment, the most effective ways to do for this patient is to maintain a healthy lifestyle, such as minimize drinking coffee, to work out, and carry out regular health checks. That's all about it, and thank you.
Hello everyone, first of all, let me introduce myself. My name is Ana Clarista Nadine, or you can call me Nadine, and my 3 last digit number of student ID number is 236. And now I'm going to continue about the therapeutic objective of this case. So based on our research, the most frequent used anti-hypertension drug is calcium channel blocker or CCB, angiotensin converting inhibitor or ACE, and angiotensin receptor blocker or ARB type. Combination of CCB and ARB can lower blood pressure in a short time and also can reduce the risk of cardiovascular disorder. For this case, the pharmacological treatment that can be used in a combination of calcium channel blocker CCB and angiotensin converting inhibitor or ACE, which is amlodipine and captopril respectively. That's it for me. Thank you.
Hello everyone, my name is Rafadiadra Fajri with my last 3 digits of my serial number is 244. Okay, so are the active substance and dosage form suitable for this patient? Okay, for the first drug is amlodipine. Amlodipine is indicated for the treatment of high blood pressure and angina. Amlodipine is usually dosed on a once daily basis because of its long half-life. In hypertensive patients, amlodipine has sustained antihypertensive effects without causing hypotension. For the safety, amlodipine is contraindicated in breastfeeding women, cardiogenic shock, and unstable angina. Other reported side effects include dizziness, fatigue, headache, palpitation, and nausea, although these are generally not bothersome enough to cause discontinuation of the drug. and amlodipine has no negative inotropic effects at therapeutic dosage. For the second drug is captopril. Captopril is an FDA-approved medication used in the management of hypertension. For hypertension, it is initial therapy for patients with normal renal function. Captopril is effective alone and in combination with other antihypertensive agents. For the safety, captopril is contraindicated with patients with hypersensitivity to captopril, angioedema related to previous treatment with angiotensin converting enzyme inhibitor, concomitant olescaran used in patients with diabetes mellitus, and co-administration with or within 36 hours of switching to or from a neprilysin inhibitor. For the third one is paracetamol. Pain is a common indication for pharmacotherapy that most often occurs in elderly patients. For this reason, effective pain management is needed. Paracetamol also has an affordable price and can be easily found at the nearest pharmacy. For the safety, paracetamol cannot be used by patients with severe active liver disease because it has a short half-life, so that in condition of chronic liver disease, the dose of paracetamol must be reduced. That's all from me, thank you.
Let me continue to the presentations, but before that, I will introduce myself first. My name is Ida Yuparatinia Surya with last 3 digits student number 230. Now I will explain about the suitability of the drugs, and the part that I will explain is the standard dosage schedule suitable for these patients. So in these cases, we have 3 drugs that we consider to give to the patients. The first one is amlodipine, the second one is captopril, the third one is paracetamol. Amlodipine and captopril is hypertension drugs, and paracetamol is an anti-analgesic drugs. The pharmacodynamic of amlodipine is that amlodipine is calcium channels blockers drugs which inhibits influx calcium. These drugs initiate smooth muscle relaxations that will decrease the blood pressure. And for the pharmacokinetics, we have 4 aspects that we consider. The first one is absorptions. So amlodipine has high bioavailability around 64% and 90%. It does not affect by food, and it also reaches plasma within 6 until 12 hours. For the distributions of amlodipine, it bound to plasma protein. And amlodipine metabolized in heparin, and the excretions of amlodipine is through urine, and the half-life is around 30 until 50 hours. Because of the half-life of these drugs, amlodipine can be consumed once a day. And for elderly, the recommendation dosage of amlodipine is 2.5 mg per day with a maximum dose of 10 mg per day. The second drug is captopril. The pharmacodynamic of captopril is a drug that angiotensin converting enzyme or ACE inhibitors that decrease plasma in angiotensin 2. The output of this drug is decreased blood pressures. And for the pharmacokinetics, captopril rapidly absorbs in empty stomach around 60% until 75%, and it means food affect the absorptions of these drugs. The second one is distribution. So captopril bound to protein, especially albumin. Captopril metabolized in heparin, and the excretions of captopril is through urine, and the half-life is around 20 or until 40 hours. Captopril is better taken in 1 hour before taking a meal, and because of this drug's half-life, the recommendation dosage for these patients is 25 mg 2 or 3 times a day. And the last one is paracetamol. Pharmacodynamic of paracetamol is thought to produce analgesia through a central inhibition of prostaglandin synthesis. And for the pharmacokinetics, it can be absorbed in GI tracts or rectum, and the bioavailability of this drug is 63% until 95%. And for the distribution, it almost in all body fluids and tissues, and it also binds with red blood cell. Paracetamol metabolized in heparin, and the excretion of paracetamol is through urine, and the half-life is around 4 until 6 hours. Paracetamol is given according to the patient weight at a dose of 5 until 10 mg per kilogram BW of patients with a durations of 4 until 6 hours. These medicines can be taken before or after meals.
That's all, thank you.
Before I continue the presentation, let me introduce myself. My name is Tabita Eptirina Prescribing with last 3 digits of student number 232. So, I will explain you about is the standard duration of treatment suitable for this patient. So, hypertension is a long-term treatment, where the treatment will continue for the life of the patient. However, the dose of the drug can be reduced if the patient's blood pressure is controlled. But if it fails, the treatment must be restarted from the initial start in a short time, and the patient's adherence to the treatment will deteriorate. Therefore, it is necessary to have clinical parameters that can predict success. Maybe that's from me. Thank you.
Before I continue the presentation, allow me to introduce myself. My name is Gusti Nita with the last digit of student number 233. Here I'll explain about the prescription for this case. So first at the top, we have the identity of the prescriber. We have the name, Dr. Luh Elisa Sintadewi. Then we have the address, Jalan Raya Murak number 99 Dan Pasar. Then we have the telephone number and the medical license. Then below that on the right hand corner, we have the date and place where the prescription was written, which is Dan Pasar, 12th of May 2023. Then below that, we have the superscription R/, then we have the inscription amlodipine 2.5 milligrams, tab numero 30. So we have the drug name amlodipine, then we have the dosage 2.5 milligrams, then the dosage form is in tablets, and for the quantity it's 30 tablets. Then below that we have the signature, so it's S1DD tab 1HM, where S is the signature sign, then 1DD means it's to be taken once a day, then tab 1 means with each intake the patient takes 1 tablet, then HM means it's to be taken in the morning. That's all from me. The next part will be continued by my friend. Thank you.
Hello, my name is Koma Asri Bunga Sudani with the last 3 digit of student number is 241. I will continue to explain about the prescribing. After the amlodipine drug is paracetamol. Paracetamol is used as a supporting drug to release the pain in the patient's head, as it's shown in the case that patient had a headache on the back of the head. So for the drug prescribing is R/paracetamol 500 milligrams, tab, and OX. Tab is a drug form, is tablet, and OX is numero X, or the amount of drug is 10 tablet. So the patients will receive the paracetamol in the form of tablet, dosage form of 500 milligrams in a total of 10 tablets. Then to explain how to use the drug is S3DD tab 1 PC PRN. 3DD means 3 times a day or every 8 hours. Tab 1 means 1 tablet for every taken. PC means to be taken after eating. PRN means to be taken if it needed. So the patient will take the paracetamol 3 times a day, once take 1 tablet. Paracetamol will be taken after eating and also to be taken if needed or headache symptoms is appear again. The last part in writing a prescription is identity of the patient. The patient identity is useful so that the drugs are not exchanged with other patient, useful for determining dose in the children, and if the drugs belongs to a narcotic class, the address section is very important so that there are no mistakes in drug delivery. So because in the case not mentioning the name of the patient, we write Mr. XX. He is 65 years old. His weight is unknown. His address is also unknown. So we write X Street, number 25, Denpasar.
Hello everyone, let me introduce myself. First, my name is Komang Tangkas Atnyasiana with the last 3 digit student number of 224. And now I would like to explain about treatment information when using amlodipine. First, amlodipine is an oral dihydropyridine calcium channel blocker. Amlodipine blocks voltage gates L-type calcium channels, thereby inhibiting initial calcium influx, decreased intracellular calcium, decreased vascular smooth muscle contractility, and increased smooth muscle relaxation, resulting in vasodilation. Furthermore, amlodipine improve vascular endothelial function in hypertensive patients. Amlodipine lowers blood pressure by causing smooth muscle relaxation and vasodilation. Serious side effects of amlodipine include peripheral edema, heart failure, pulmonary edema, flushing, dizziness, headaches, drowsiness, rash, nausea, abdominal pain, and constipation. In controlled clinical study, investigators assessed dose dependent edema, dizziness, hot flashes, and palpitation. For example, the incidence of edema, dizziness, flushing, and palpitation at the 10 mg dose was 10.8%, 3.4%, 2.6%, and 4.5%, respectively. In addition, the incidence of headaches, fatigue, nausea, and abdominal pain was 7.3%, 4.5%, 2.9%, and 1.6%, respectively. Recommended dosage for adult: initial dose 5 mg once daily, maximum dose of 10 mg per day. Geriatric and debilitated patient reduce initial dose to 2.5 mg once daily, maximum dose of 10 mg per day. Adolescents and children 6 years of age and older, 2.5 to 5 mg once daily, maximum dose of 5 mg per day. Children 6 years of age or younger, 0.05 to 0.2 mg per kilo per day. Maximum dose maximum dose 0.3 to 0.6 mg per day. Patient with hepatic impairment, amlodipine is primarily metabolized by the liver, and the plasma elimination half-life is prolonged with impaired hepatic function. Gradual titration of the dose is recommended. The initial dose is 2.5 mg once daily for hypertension, of 5 mg once daily for angina. Adjust the dosage based on clinical response. Patient with renal impairment, the pharmacokinetics of amlodipine is not significant influenced by renal impairment. Consequently, patients with renal impairment don't require dose adjustment. In patients with heart failure, amlodipine can cause pulmonary edema and shortness of breath. That's all for me. Thank you.
Hello everyone, my name is Igusa Eplasafita Sikirana with the last 3 digits of my student ID number are 212. In this presentation, I will be explaining about the treatment information of captopril. So first, the first effects are as listed: paroxysmal cough with the number of 1 to 10%, proteinuria with prevalence 1 out of 100 patients, renal dysfunction with the number 0.1 to 0.2%, Raynaud syndrome with the number 0.2 to 0.3%, and hyperkalemia. For the administration, captopril must be taken 1 hour before meals, with analysis of recent antihypertensive medication therapy, blood pressure increase, and salt restriction. The daily dose can be increased once every 24 hours with ongoing physician supervision. Initial dose is 25 mg twice per day BID or 3 times per day TID. For monitoring, patients with collagen vascular disease and or impaired renal function should have a complete blood count with differential check before starting captopril. Patients with heart failure should be closely monitored for the first 2 weeks of treatment and whenever the dose is adjusted. Hypertension recommendations suggest keeping blood pressure under 130/80 mm hectogram. That's all from me. Thank you.
Hello everyone, my name is Farel Armando Damanik with the last 3 digits of student number 243, and today I'm going to explain about our student project of SGD B10, especially the part of evaluation, and I'm going to talk about amlodipine. Amlodipine has been shown to be an effective antihypertensive agent in the elderly and was actually more effective in the elderly patients compared to those aged less than 65 years. It also has a low hepatic metabolism, and a long elimination half-life, which also allows effective blood pressure control and with once daily dosing. Flushing and headache were less common with amlodipine than with other dihydropyridine type calcium channel blockers. Similarly, the incidence of other serious events such as stroke, cancer, gastrointestinal bleeding, and death was low, and none was attributed to amlodipine. The predominant side effects of amlodipine were related to vasodilatation, such as edema and dizziness.
Hello, my name is Komang Surya Mahatama with the last 3-digit student number of 221. Today I will tell you more about the drugs used for hypertension. The name of the drug is captopril. A medication called captopril is used to treat diabetes-related kidney disease or diabetic nephropathy, hypertension, and heart failure. This substance may be taken either on its own or in conjunction with other medication, such as diuretics, even if you feel no complaints. Do not quit the medication without your doctor's approval. A healthy lifestyle must be combined with captopril treatment. You can achieve this by consuming less salt and fat in your diet, working out frequently, and quitting smoking. Thank you.